Hey everybody, welcome to Psychology Element. Did you know that there are 10 specific personality disorders? Did you also know that a single individual can have comorbid or overlapping traits or features of others, making them even harder to predict? The 10 personality disorders are arranged into three types: Cluster A, Cluster B, and Cluster C. Cluster A personality disorders are described as odd or eccentric and include the following: paranoid, schizoid, and schizotypal personality disorders. Cluster B personality disorders are described as dramatic, emotional, and/or erratic. These include the most known personality disorders: Antisocial Personality Disorder, Narcissistic Personality Disorder, Borderline Personality Disorder, and Histrionic Personality Disorders. The last, Cluster C personality disorders, are described as anxious or fearful and consist of anxious, avoidant, and obsessive-compulsive personality disorder. Although these psychological disorders are amongst the hardest to treat, there are options. Metacognitive interpersonal therapy is one newer type of therapy that is becoming more widely used among therapists treating personality disorders. You might be wondering what on earth metacognitive interpersonal therapy is, so we'll do our best to explain. But we at Psychology Element highly recommend that you speak to your doctor or therapist if you're interested in more information. But essentially, the therapist will try to build their metacognitive interpersonal skills. Examples of these skills would be solving problems in relationships, being more aware of oneself and the consequences their actions have on others, and self-regulating their behavior in response to others. Alright, let's get started. Number 6. They have an impaired or intellectualized narration. One area that people who suffer with a personality disorder experience dysfunction is the manner of which they narrate their lives and their perceived reality. Therapists who specialize in metacognitive interpersonal therapy are trained to decipher their narration of their lives and teach them to have a healthy or good narration style. When a healthy person is describing a personal story, their narration will clearly consist of their motive for their actions. When a healthy person is describing a personal story, their narration will clearly consist of their motive for their actions, what they hoped would be the outcome, or why they had to endure the consequences of their action, who was involved, where it happened, and when it took place. Although in therapeutic settings where people may be more emotional, healthy individuals can struggle with a clear narration. But unlike with personality disordered patients, the therapist is able to easily navigate and pick out the important details and emotional states. In personality disordered individuals, therapists usually see two types of narrations: impaired or intellectualized. People who use an impaired narration style will describe emotional experiences with vague and short sentences, usually not giving the therapist much insight into their mental state or motives. Often they don't have many long-term memories, so the therapist is unable to draw any abstract causal answers in their past for their present behaviors. Metacognitive therapy is beneficial for these types of people because they focus on the mental states the patient is able to portray, and they largely focus on specific incidents the patient wants help on. However, this can make things more challenging when not given past psychological insight. For example, one case study describes a 30-year-old male who has a severe avoidant personality disorder with passive-aggressive and schizoid traits with covert narcissism features. He had just admitted to engaging in an affair with a woman he claims to have no romantic interest for. When asked by the therapist why he started the affair in the first place, he instead focused on why it would not work, stating that they come from different political backgrounds and are from different worlds. He was also emotionally flat when he described himself as, quote, one able to serve between situations. I've got my way of navigating with a certain stylishness so as to manage any possible problems, which then in fact do not necessarily crop up. This impaired narration gave the therapist little insight to the patient's motives. An intellectualized narration style is often focused on abstraction, metaphors, and broad generalizations which make it confusing for the therapist to decipher. For example, one patient with NPD and paranoid traits stated that they, quote, keep their women at a distance because they try to trap me and restrict my freedom. The therapist has no insight as to whether it's a specific woman or women in general, nor the reasons for their fear of being trapped. In contrast, a patient with avoidant and dependent traits might say, quote, if I lose my girlfriend, no woman will love me because I'm useless. Again, this narration might be sad, but it doesn't give insight to the causes of those feelings. Number 5. People with personality disorders often have an impaired sense of self-agency. What exactly is self-agency? Well, in psychological terms, agency is the quote, subjective awareness of being inhabited by wishes, intentions, and goals, and of the ability to initiate, carry out, and control actions aimed at achieving them. And having a sense of self-agency is the awareness that our actions and decisions are generated within ourselves. It's the feeling of being in control of your own body and life, that if you want something realistic, it's within you to generate the actions needed to reach your goal. Because personality disorders are developed in childhood, their lack of self-agency or control over their thoughts and behaviors is often due to their parents not fostering a secure attachment style. For example, one patient with an avoidant personality disorder, paranoia, and social phobia described a childhood incident where he asked his mother if he could join the school soccer team. Without even looking at him, she belittled him and said, quote, "Why would you want to join the soccer team? Didn't you want to do piano? That's much less dangerous and nicer." Because his mother did not nurture his self-agency and let him do what he wished, which was playing soccer, it fostered the negative belief that he doesn't have his own self-agency to decide his actions. Number 4. They often have maladaptive mental schemas, especially regarding relationships. Maladaptive mental schemas are very prevalent in people with personality disorders. If you're wondering what mental schemas are, don't worry, we'll try to break it down for you. Mental schemas are cognitive or thinking structures that are typically developed in early childhood that help us interpret, organize, and understand the world around us. Think of them as shortcuts our brains make to make interpreting information easier. Unfortunately, when toxic or maladaptive schemas are formed in childhood due to abuse or neglect, they'll carry these bad shortcuts with them through adulthood. The maladaptive mental schemas that are most frequently found in people with personality disorders are the ones involving interpersonal relationships. So basically, the unhealthy cognitive structures formed in childhood can cause them to perceive other people as inherently good or bad, often for illogical reasons. The black and white thinking that is frequently found in personality disorders, especially borderline personality disorder and narcissistic personality disorder, is largely due to these maladaptive mental schemas, and can be one reason for the trademark splitting found in BPD, or the idealizing/devaluing cycle seen in narcissists. One example of an interpersonal mental schema would be attachment. It's not uncommon to see people with personality disorders view attachment as being something that is good and quote-unquote needed in order to survive, or something that is bad and should be avoided at all costs because they'll be abandoned. This all-or-nothing attitude found in personality disorders can prevent them from ever engaging in a healthy relationship, instead self-sabotaging to protect them from their predictions of how the other person will act. If you like what you're hearing, click like and subscribe for more great content. Number 3. A pattern of unstable interpersonal relationships. It's unsurprising that due to their maladaptive mental schemas, people with personality disorders often have very unstable interpersonal relationships. For example, it's not uncommon for someone with a cluster B personality disorder, like narcissism or borderline, to have multiple marriages, affairs, or stormy emotional breakups. But why is that? Well, because of their toxic mental schemas, giving them incorrect shortcuts to navigate the world around them, their manner of behaving in a relationship will be unhealthy as well, leading to instability. For example, if in a healthy relationship, one partner offers a bit of constructive criticism to the other, the partner will accept the criticism, but without it impacting their self-worth or self-esteem. Now imagine dating a narcissist. If their partner offers them constructive criticism, they will feel humiliated and unworthy. Because their disordered ego cannot comprehend that, they'll often belittle their partner to bring them down to their level. This makes it difficult to have any healthy relationship development. Metacognitive therapists attempt to bring awareness of these unhealthy cycles and emotional reactions, and train them to stop escalating minor incidents into problems. Number 2. Repetitive, unwanted, or unhealthy mental states. Repetitive, unwanted, and involuntary mental states are consistently seen within personality disordered patients. These mental states often cause the patients suffering and distress, at times making it near impossible to carry on with their daily lives. For example, an avoidant person might periodically feel shame when given criticism, and thus cope unhealthily by isolating. Similarly, BPD patients might uncontrollably disassociate as a mental state and a coping mechanism. Number 1. Multiple toxic coping mechanisms or improper cognitive biases. Toxic coping mechanisms are a trademark of any personality disorder and are habits that the therapist will try to break. Different personality disorders are more likely to present specific coping methods more frequently than others, but all personality disorders are capable of engaging in these coping methods at various points of their lives. One example of an unhealthy coping method seen in personality disorders is mistrustfulness. People with personality disorders might turn to a state of vigilance and watchfulness when presented with thoughts or beliefs that others could threaten, humiliate, or betray them, regardless of whether it's based in reality or imagined. This coping mechanism is frequently seen in patients with narcissistic, avoidant, and/or paranoid personality disorder. Another example is compliance or submission, when someone submits too easily, often giving up their own values or perception to someone else. This is often seen in dependent and avoidant personality disorders. These are just a couple of examples, but there are many other coping methods seen by people with personality disorders. Be sure to check out our video on dangerous coping mechanisms you should not ignore. And for more videos like this, don't forget to like and subscribe, or check out some of these other great videos. Did we forget anything? Can you relate to any of these dimensions or know anyone who can? Let us know in the comments below. And thanks for watching.